and we'll have to move on to our next presenter, which is Jonathan Glanning from the Murdoch Children's Research Institute. Jonathan, feel free to start screen sharing. And Jonathan will be talking about the accuracy of WatchBP for non-invasive estimation of central blood pressure in children. Take it away, Jonathan.
Alrighty, thank you very much for that introduction. So with accurate central blood pressure measurement, it could be possible to identify children at high risk of hypertension in adulthood more effectively than ever before, and with large potential benefits for global health. So as we know, the current standard BP screening measurement is one of peripheral blood pressure. And this can be taken with a device such as the WatchBP Office Central, which is validated for the accuracy of its brachial BP measurements in children as per the AAMI guidelines. However, there is some evidence that central blood pressure has better prognostic value than this traditionally measured brachial blood pressure. This can be measured through two different means, measuring it invasively with a micromanometer tipped wire passed through a catheter, or non-invasively using an empirical equation or a transfer function on peripheral BP measurements to estimate this CBP. And the current gold standard for central blood pressure measurement is that invasive approach, and therefore all non-invasive approaches need to be validated for accuracy against that standard. In this case, Accurate is internationally recognized as a mean difference of within 5 millimeters mercury and a standard deviation of within 8 millimeters mercury. To date, no CBP device has passed validation in children, with two notable devices recently failing in our lab's Kid Core BP study due to poor calibration of their peripheral BP measurements. And this raises the question of whether a device that has been validated as having accurate peripheral BP measurements will be accurate at estimating central BP in children. And this question is what is at the heart of our study. We're aiming to evaluate the accuracy of the central pressure estimates of the WatchBP Office Central, which has had its brachial measurements validated in children and its central estimates validated in adults. And after seeing the results of the Kid Core BP study, we hypothesized that the WatchBP will accurately estimate central blood pressure because of that accurate peripheral BP. So the methods we used to undertake this study follow the Artery Society guidelines as much as possible, though keeping in mind that they were created for adults rather than children. And we've had 18 participants to date who have had neither aortic obstructions or shunts, ranged in age from roughly 4 to 16 years, and were 56% female. Each of these participants had a high fidelity micromanometer tipped wire placed in their ascending aorta, while the cuff of the WatchBP was placed around their left arms. They then had at least 2 simultaneous recordings of the central pressure from the wire and both a brachial and central pressure estimate from the WatchBP. And we found that the WatchBP vastly overestimated that invasive pressure with a mean difference of 26.1 millimeters mercury, though it had an acceptably accurate standard deviation of 7.4. And this is further illustrated in this figure where in every measurement, the WatchBP overestimated that reference pressure, as well as in this modified Bland-Altman plot, where the lower limit of agreement doesn't reach the range of acceptable accuracy denoted by the green box. So from these results, it's clear that the WatchBP substantially overestimated CBP in children, refuting our hypothesis, which further highlights the need for more work to be done developing accurate techniques for central blood pressure estimation in children. Thank you very much.
Thanks, Jonathan. Sorry for the delay there. Again, I guess any questions, please send them through or raise your hand. There we go. Gavin's got a question. Given your team's expertise in working with kids with coarctation of the aorta, do you plan to use the device in this cohort?
I can't speak specifically to that just because I'm not familiar too much with what we do with coarctations in terms of a clinical context. But we have used this device to complete research in kids with coarctation of the aorta, looking at interarm blood pressure differences. But in terms of clinical care, I can't speak to that, unfortunately. Sorry.
Okay. Genevieve has asked, how many peripheral blood pressures did you take to get the blood pressure result?
So in each case, we took at least 2 different peripheral blood pressures as well as 2 central blood pressures.
Okay. And Richard is asking, are you interested in doing similar studies on other central blood pressure devices in children?
I'm sure we will. It's one of the central sort of themes in our lab's overall research goals is to look into better ways to accurately measure central blood pressure in children, just because there aren't any devices out there, and while we're not actually looking at other central BP devices right this second, we are looking at creating a new equation that we can use for any BP device, cuff-based BP device, to estimate central blood pressure in children, because most of the equations are based on adults as opposed to children.
Yeah, yeah. I think Richard's added a bit more. Talk to me about a sample USCOM BP plus.
Oh, okay, that's very kind. I'd refer you to my supervisor on that one.
And then I guess Audrey's also asked, have you had the opportunity to look at gender and height association in these children with their blood pressures?
We haven't yet. This is still a work in progress, unfortunately, but we will be looking at that into the future just to see what's there and what's not.
Awesome. Thanks so much, Jonathan. I think in the interest of time.
Thank you very much.